subtitled The Co-Production Imperative, and don't worry about looking all that up, because there is at the end there's a slide with some links and stuff. I thought I'd better try and be slightly professional. And I read about this, man, and he was a civil rights lawyer in the States in the 1960s. He was a speech writer when Robert Kennedy was in charge. For Robert Kennedy, he did loads of stuff around access to justice for people in America, for people who were marginalized in society, with Native Americans and so on and so forth. And he had a massive heart attack at the age of 46, and the person that he thought he was gone, and he was lying in a hospital bed. When I read his book, when he talks about this, it's exactly how I felt, that he was suddenly this passive recipient of everyone else's help. But surely that was a waste, because he was still, and he created time banking. Started the time banking movement. The work of the New Economics Foundation and the National Endowment for Science, Technology and the Arts, NESTA, this is their definition of co-production, which is there at the top of the ladder, is very much based on Edgar's work. I don't really do gurus, but I really am a guru of Edgar Khan. I met him and he called me a hellraiser, and it was like one of the best moments of my life. Man called me a hellraiser. Oh, I have to tell my mother. I like it because it's equal and reciprocal. See, I can say that now I'm sober. Try and say that when you're drunk. Reciprocity. Agents of change. How much of the tokenistic crap that gets touted around as service user stroke patient engagement actually is an equal and reciprocal relationship where there's a power shift? Very little. There's a lot of talking about it, but it very rarely is. And to what extent are we actually changing anything by that stuff? That's what interests me. These are this is the boring bit. You can get these are the actual core principles that, most work that goes on we're involving, I don't know if you call us clients or whatever you call us, but most of it won't have all of these going on. But if you kind of bear that stuff in mind, it's a really useful framework for any kind of work like this that you're doing. I think a lot of the service user engagement stuff is based on us having expertise by experience of a health condition or whatever. It doesn't kind of take into account all the other skills and assets we may have. And Edgar said this about, you can't actually, that's still considering us as a collection of needs. Even if that experience is being used in some way to change services, it's still not quite using all the assets. I used to run committees. I ran a session at the Rio Earth Summit before I became ill. I have other abilities, but it's almost like when I got diagnosed, I had to hand in all of that in return for those labels. And Edgar, really has it. So I really suggest reading his book because he's fantastic. And I got the academic bits about Edgar's work. And I thought, right, I want to go and see if it actually works, because I'm a great one to have, the theory and all of that. And I discovered when I got out of rehab, they wanted me to do something useful when I got out. Well, what do you mean, like not get arrested and stuff anymore? Right, okay. So they wanted me to be a useful citizen coming out of rehab. So I looked up Edgar Khan. I looked up volunteering in London, blah, blah, blah. And I found out that Edgar, though he's based in Washington, he was advising a centre in Camden, the Holy Cross Centre Trust, and that used to be a soup kitchen. And they changed over, working with Edgar as an advisor, they changed over to a time bank, so the people using the services there were getting paid for what they did in that centre, but they were getting paid in time bank credits. Now I understand from Professor Becky Mulby, who's a new professor here at South Bank, that South Bank's planning to do some work with time banking with an organisation called SPICE, Just Add SPICE. You can look them up. But I did time banking, and I've got another prop here. Yeah. Now I hadn't worked for money for many, many years, and I went and worked in that centre I worked as a support time recovery worker with people who were homeless, who were in the situation that I'd been in. Very, very chaotic, just like I was. And I went and worked, and at the end of every shift, for 1 hour, I got one of these. These 1, 2, 3, that's 4 hours of my time. At 3 hours, that's one shift on a Monday afternoon. I got paid, and I could use these in the time bank, where all the various services in that area, in Camden, King's Cross, St Pancras, they had donated into the time bank, like really exchanging resources with no money changing hands. I used it for accredited training in community mental health, which is what I did. Most importantly, I felt different when I got rewarded with something in my hand like this, and so did the guys in the centre. A bunch of homeless guys came and spoke to me it was full of F's and C's and everything, but said, "We know what we effing want to effing use our effing them money things. We want to go to the ballet." And they did. We went together. We went to the Nutcracker at Sadler's Wells because they were a member of the time bank. They were using rehearsal space, which they were getting free from the German gymnasium at St Pancras, because they were getting mental health training from us. So there was that exchange of resources going on. Spare tickets were being donated into the bank, the time bank. Our guys did it, and we sat in the front row, and they were like, "Oh, effing hell, effing, did you see that? Effing this." It was fantastic, and it was, we weren't making the assumptions about what they wanted to do. I would never have thought in a million years those guys were going to want to do that. I would have thought, we're going to go down and get a burger or something. My assumptions, but they knew what they wanted, and it was something quite different. That's what I like about co-production. It's not about slotting into what's already there. It's about risking, blurring some of that stuff. And believe you me, they're hypocrites, Department of Health, because I work for them and they completely don't get it. But they're good at talking about it. And what gets in the way of it? I now work in the NHS. I've got an NHS contract, although I'm an independent consultant. I see a lot of fear in the system. I can feel it. I think the reason I had such a good admission this time is because my attitude was different. Because I'm between professional and service user now. It moves. My identity moves from one to the other, and I think it needs to. Because when you're too stuck in one box, you're kind of only seeing part of the picture. So I used to feel quite uncomfortable trying to work out which one am I. Which one am I now? Am I really still a patient, service user, or am I blah, blah, blah? And when I sussed out that actually it's flexible and it moves, I felt frightened of coming out of the patient box, service user. It used to be quite comfortable. It was really crap in there, and I really was watching daytime TV and stuff. It was dark, but it was familiar. And I see this in particularly in healthcare, a lot of fear around the system at the moment. I did some study in the NHS Leadership Academy, and I was the only patient to be doing that. I'm doing a master's with them at the moment. First day, all frontline staff from all across the whole range of services. First sensation I had was fear, really. How am I going to do this? Am I going to be free to speak in this course? I don't have support, the uncertainty, the this, the that, the cuts, the everything. And it's modified my approach. I've been told I've toned down from militant to radical as a result. So I think that's about as far as I can go, really. So that's the thing about the boxes. This stuff is just, because of the system, the fear that's in the system, there's a tendency to barricade ourselves. And when I realised that I too was scared to go into that kind of minefield in the middle. But I realised that's what I had to do in order for things to change. But my approach is different. It used to be about Semtex. I used to think it would be the best thing to do was just to nuke those barricades, but you just end up destroying stuff. So it's better to plant seeds. And I'm not a fan of take-home messages, but you see the thing about the colouring and the forcing into box. People don't really fit into boxes, and neither should professionals have to. So that's just going into the profession. Don't be afraid, please, to colour outside the lines. I've never been able to colour out. That's the best I can do when I try that shit. And so it's better not to try. So, you know, it's frightening at times, but do it. These are the resources. I'm hoping that the amazing Kelly over there will be able to give people the links, because I thought you might like to look up some. That's Professor Mulby. It'd be good to crawl to her, actually, because she's quite important around these parts. But she's written some blogs on co-production. She really gets it, and they're short. Read them. That's Edgar Khan's book, and this is more useful stuff. Assets-based community developments, where it's at. Co-production, these are the best resources on, and that's the organisation that I mentioned that's going to be doing this work. Because you know there's a People's Academy now at South Bank, full of people who've got great stuff to come and tell you. So there's a whole bank of people that can come and talk to you if you've not got anything out of what I've said to speak to. As for me, I loved the idea of personalisation, so I decided to apply for a personal budget a few years ago, and I didn't want to do what it was assumed I would want to do. I went back to see if I still could speak Russian. I was so traumatized that I couldn't even have the mention of the word Belarus, and I'd kind of go a bit weird. I'm sure I'm not alone with that. It's kind of an interesting country. Last dictatorship in Europe, supposed to be, but anyway, I went and did my evening class in Russian, and I got a personal budget for it. And this is what recovery was to me. This year, I went back to Russia for the first time in 20 years. And this is me, where I had no voice as a service user. I felt completely silenced. I couldn't, you know, it was a horrendous experience. It totally changed my personality. But that's me standing on a stage in Russia, in the same city I went to when it was still a secret city, actually, connected to aviation, which is why all the planes are there, making a speech in Russian, just telling people in that city how wonderful it felt to be well enough to do this, to stand in front of them and speak in Russian, make a speech. That's what recovery was for me. And that's all I'm going to say. Do follow me on Twitter. I hope I haven't gone on too long, because I've got the plumbers coming later. My bathroom's leaking. I knew that I was knee deep in shit. Today has like literally been the case. It's too much information. Now, I don't know how much. Have we got any time left, Mrs.?
Yes. Well, if you've got 10 minutes to take any questions.
I have.
Any questions, Alison?
Comments, questions? Hi.
Hi, Alison.
Hello.
Alison, I'm one of the Darcy Fellows.
I know, I thought, God, I was getting this weird.
Don't hear us. I've got a project, but a huge part of my project is reducing frequent flyers.
Hooray!
Do you have any, obviously I understand we have to patient engage, not talk about it, write a report, and then pretend we're doing it. Do you have anything, what's the one tip you would give me?
Well, the reason I was a frequent flyer is just the lack of connection between social care and housing. It's absolutely vital to bring housing into the equation. It was like they were on a different planet. And the assumption that frequent flyers or bed blockers, I was known as a bed, I was out, not only, I became so frequent, I just stayed. It's like they joined together, and I ended up a year. I think you know this because I think I said it if you were paying attention at the launch. I was a year on a psych ward, and that was that I didn't need to be on. And it costs more than the Dorchester per night. And it's also, beds are very, very scarce, as people who've done placements who are working in mental health know. So why was I there? Why was I there? It was because of the disconnection with the social care and housing. And I mean, I know there's lots of talk around integration and whatever else, but it really is an attitude in my boroughs, Kensington and Chelsea, might as well name and shame. I made sure I got homeless in the richest borough in the country. They said, housing officer said, we don't deal with people, we deal with bricks and mortar. And while that attitude still prevails, and that's not long ago, that's the problem. And is there an easy answer? No, there isn't. But the more you talk to people that have been there and can articulate what's gone on, that will hopefully help you draw out some real stuff that you can use. But do contact me, because I'd love to be involved in that one. Because I've been called a frequent flyer. I've been called the heart sink patient. Because when we turn up, yet again, the clinician's heart sinks. Because you're just going round and round and round. Oh, God. So, you know, that's why I like to give back now. Because I feel... I knew individual phlebotomists. I was in hospital so often. If they'd have asked me, that's what I'd always say. See, I'm off on a roll now. If they'd have asked me why was I in hospital every 2 weeks, they thought I had a rapid cycling form of bipolar. That was exactly a 2-week cycle. It was nothing to do with that. It's because my benefits would run out, and I'd not be able to access enough alcohol to stave off withdrawals, and I'd have a fit, and I'd end up getting hauled into hospital. Then while in hospital, I'd make a rapid improvement because I'd work out that my money had gone in the account, so I'd be off and out and at it again. So that's another thing. Look at things like on the mental health ward when I was there just a few weeks ago, there were beds being occupied by people who were there for housing and social care, and there's no beds. There's no beds. Anyway, that's a little. It's almost like I planted that one. That was a good one. Yay! Anyone else? Yeah.
Well, first of all, thank you so much. That was absolutely fascinating. And I've actually been to Belarus. I've never met anyone that's been to Belarus. That's very
So when I said
exciting.
Minsk, you would have known that.
I knew.
What the hell did you go there for?
I was working with children that had been affected genetically by Chernobyl.
All right.
And I've also come from a development background as well, so it was really resonated. But
Oh, fantastic.
so thank you so much. And I wanted to ask you, over the time that you've been through the system and this process over 20 years, what positive changes have you seen, if any? And I hope there are.
Oh, I really have. It's just my dark sense of humour. I mean, really, the readiness of the staff on the ward to share their own personal experience is something I've really noticed. It's like that blurring of the boundary between. Obviously, you still need them to be clinicians and do the, and safeguard and all of that stuff. But there was something just about not being so them and us. There is definitely that going on. And I find with the staff I work with, before I disgraced myself at the King's Fund, I worked there running training for really like senior, like brain surgeons and stuff. God, they were challenged seeing me, I can tell you. And I noticed that a lot of them, even the further they go up the ladder, they felt they didn't have permission to go there, into the reasons why they went into the profession in the first place. It's like the system had kind of knocked it out of them. So what I've noticed is there's this, that is starting to change, that people are, that it's being recognised, that actually it makes people more effective in these professions. If there's some, because we've all got some kind of a personal experience, whether it's a family or ourselves. I work with medical students, and it's great. There's one that came and spoke to me afterwards. She said, I've been in and out of mental health units throughout when I was a teenager. She said, you've helped me to see that it might actually make me a better doctor, not a worse one. And these are changes, but unfortunately, I want revolution. I want the whole thing right now, like, let's shake like a snow globe, let's mess it all. I love doing all that stuff, but it isn't. It's like really slow, but I think it is happening. And boy, have I met good people along the way. This is where I probably cry. I remember being on suicide watch in Chelsea and Westminster, my A&E of choice. I've done many, but that's my favourite one. I felt really, at the end, and there was just one psych liaison nurse, and I really remember her tucking me up with a blanket on the trolley, and it's just, these gestures, like small gestures of humanity, when, that picture with the dart, the factory, the one who flew over the cuckoo's nest, that was more like how I felt about myself. It wasn't really a reflection. The system wasn't great, but it was more about how I felt. You don't know how much you affect people just by those small gestures of humanity, really. And it's generally speaking been nurses, OTs. My first tweet up was with an OT. She'd follow her, Claire OT, Claire. And I met her in real life. She's disabled. She owes her life for being an OT. She had agoraphobia, and an OT came and sat with her and inched her towards her window every day. Inched her towards the window and got to the window. And she never forgot that OT and went and studied and became an OT herself. She buzzes around. She's amazing. She buzzes around on this scooter thing because of her disability. She's a single parent. She's got these 2 little kids. The shopping and the 2 little kids on the scooter, all bzzz. And she came, and I was so affected by meeting her in real life and what an amazing woman she is. I started crying as soon as I met her. So I've got a, you know, I know I'm saying this because it sounds like I'm Crawley, but I think that there's something about the line of work you've chosen to go into that it's so close to the things that I believe in about seeing people for what we can do rather than what we can't. Just being seen as a bundle of needs to be met. It's just maybe kept me safe, but it was like being wrapped in bubble wrap. Mm-hmm. And there's something about just being seen for something else that it's always been OTs and some of the mental health nurses that have got that stuff rather than the real clinical, which you need as well. But it's like you're in a unique position, I think, to work in this way, to help unlock some of those assets. So when we're frozen like that, we can't necessarily do it ourselves. That's why we need you guys. We really do. So that, I think, is me, unless there's anyone got burning. But please, if you've got any questions, if it comes to you throughout your training, whatever, contact me on Twitter. Yeah, you know, I'm always happy to help out in whatever way I can. And good luck. We need people like you. Keep going and don't listen to angry old bags and don't make people make you. Thank you for having me. Is that all right, Mrs.? Yes. That'll do. Can I have a biscuits now?
You can have biscuits now. Thanks everyone. I'm getting blinded by the projector. If you just make sure that everyone has signed in with the sign-in sheet that Rachel has at the back there, and that you've double-checked your email addresses. CPD certificates will be sent out by the weekend. Thank you very much. Thank you.